Okay, the good old internet. Well, let me go ahead and get started and tell you guys, when it comes to marketing in the internet, when it's time to get people to know who you are, which is very, very important, we literally spend and have a full training just on websites and social media. But I wanted to be able to touch bases with you guys regarding the internet and how to be able to get the word out and get those introductions, and how to be able to get those appointments. Where do people look today? Recently, I read a study when they talked about personal desktop computers. You know, those big old box computers that used to go on top of your desk or under your desk, and you had this really crappy thick monitor on the top of your desks as well, or your study rooms. There's a study that's been said that between the years of 2010 and 2015, there's been a 50% drop in purchases on desktop computers. So most people nowadays are doing what? They're purchasing laptop computers or hybrids, which are laptop/tablet computers. What is really also amazing is that people are now starting to use their mobile devices, you know, your Android phones, your iPhones, your Windows phones, your Blackberries, more and more now than their computers. They're using those products more and more now to do searches. So what you want to be able to make sure is you have a website. And if you don't have a website, make sure you go ahead and invest in one. Don't just do those free websites that does not have your own personal web address or your own personal, www.yourhomehealth.com type of a setup. You want to make sure you have that, and don't use any cheap website builders. You need to be able to make sure your website is more than just a typical virtual brochure. You want to be able to have more things in there, more stuff to offer, making sure that you have video presentations in there, making sure that you have great high quality photos and not just poor pixeled photos. Okay? You want to be able to make sure that your social media is linked in with your regular websites. You want to be able to make sure you take advantage of YouTube, of Facebook, of Instagram if you want to be able to get into those things. But most important ones is LinkedIn, YouTube, and Facebook. Those are the best ways to be able to get people to know you and hopefully for them to want to be able to meet you. Remember, we talked about the phone and the walk-in is the most effective ways to get those appointments. But your internet, your website, and your social media will build a buzz about you, so when they actually look you up, they know you actually exist. Make sure that you actually have the name of your company, your phone number, your address, and all that stuff posted under Google. So if you type the name of your home health agency, and if you look into Google, type the name of your home health agency, does it pop up with your address? On the first part, does it pop up with your phone number? Does it pop up with your brochure, with your logo in it, the times of operations, a quick description about your company? You want to be able to make sure that those are easily searched about your products, about your company. Very important for people to know who you are. It validates that you exist. Most people nowadays, if they can't find you in the internet, they don't believe that you exist. Okay? There are companies out there who does not even have their own office, but they are valid because they have a website. So let's talk about cold calls. And this is vital for you to be able to have. The techniques of learning how to make phone calls, how to get those appointments. And the first thing first is just to get the bravado, just to get the, to get past the fear of calling people, to go past the fear of having a rejection, having somebody say no, having somebody hang up on you. Has it ever happened to you where somebody hung up on you? If the answer is no, that means you don't make enough phone calls. But I will guarantee you that there's been a lot of people who's called you that you hung up on. So I want you to think about how those people felt. That you hung up on them, that you didn't have the time to speak to them, that you didn't like the offer that they were giving you, that you felt that they were soliciting you. How many times did you call and you answered and you say to the person, you know what, take me out of your call list? Why are you bothering me? You're annoying me. Why is this person calling me? Has this ever happened to you where people called you and that's how you feel? That you get pissed that they took time out of your wonderful, beautiful day? It sucks. But guess what? For you to get those appointments, for you to start getting referrals, that's going to be you in the other phone call, in the other line. And people are going to hang up on you. People are not going to pick up the phones. People are going to want to, get mad at you. So to be able to be successful at this, I literally brought together a lot of people to be able to give me advices. I've researched this. I've made thousands of phone calls in my lifetime to try to get appointments, to try to get people to meet with me. Whenever I'm about to have a live seminar in a particular state, I will call every single one of the home health agencies in that state to try to get them to attend my seminars. So your cold calling is literally, I will guarantee you, should be the most important thing you should learn, because it's going to get you the most appointments. And the more appointments that you can get, the more appointments you can get, the more chances you're going to get more referrals. So some people say, well, Michael, I'm just going to go by numbers. If I call 100 people, well then maybe I get 5% turnaround and get 5 people to get an appointment with me. So that's a great thing. But the good question to ask and answer there is this, okay? Well, out of those 5 people that you finally got to agree to meet with you, how many of them are you going to convert and have them start using your services? So cold calling is vital for you to learn. Cold calling is important for you to learn. Okay, let me ask this question. Have you ever picked up the phone and called a doctor? I'm not talking about set up an appointment for you. Have you actually tried to start calling physicians to be able to get those appointments? Have you actually started making phone calls to call administrators and nursing homes to get appointments? Discharge planners of hospitals, social workers of, long-term care centers or, other nursing homes as well. Are you making phone calls already? How many phone calls have you made so far within the past few months? How about today, for example? A lot of people feel that they should actually wait till their agency opens. Let's say, for example, you're just starting your agency, or let's say you're just about to start working for a company. If your agency is not up and running yet, now's the time to start learning and practicing and messing up and making mistakes to learn from it. But at the same time, as if your agency is already running, you need to be doing it also right now. But the biggest problem is this, is that when we make phone calls, when we make these cold calls, we are not prepared. We don't practice ourselves. We don't have the right tools. We don't know fully what we need to do to get those appointments. You can't just make a phone call and wing it and just go by how things goes when the other person. The person who comes prepared is the one that's going to win any battle. And cold calling is a battle. It's a battle of getting that person to actually transfer you to the person you want to speak to, and not their voicemail. It's for you to be able to speak to somebody and for them to ultimately see that there's something of value that they do definitely want to be able to meet with you. Don't just rely on the power of numbers where you start thinking about yourself like I shared in the other slide where you talk about, well, Michael, if I talk to 100 people, if I call 100 people within this week, if I can actually get a 7% conversion and get them to actually allow me to have a presentation out of that, I'll do good. Well, you forgot the other math problem. What's your conversion factor of having an appointment? You may have a 5-7% conversion of getting somebody to meet with you, but how about getting that person to start referring patients to you? What if that person you meet or that company you meet is not a good referral source? They only have one patient every 2-3 months. Because remember, it always begins from qualifying the right company, the right people. So it's not just getting an appointment. It's to be able to get an appointment at a higher rate with the right training, the right techniques, to call with knowledge and ideas. Because look, you already have the person in the phone call. You already have the ideal referral source. It's a waste of time if you can't get them and increase your chances to get those appointments. So when we're cold calling, I want to ask this question. How many times a day do you feel do you need to call people? How many people do you feel you should be calling in a month? I challenge all the people that I work with to call a minimum of 50 people a day. 50 people a day. Well, somebody's going to tell me, well, Michael, there's not a lot of hospitals, there's not a lot of nursing homes, not a lot of assisted living communities in the area. So there's not a lot of people. What are you talking about? That's 50 people a day. That's 250 a week. If you're talking about a 20-day work month, you're looking at 5,000 people. That's not a lot. That's a lot of people. There's not enough people to call. Yes, there is. There's a lot of people to call. And the reason why I'm saying there's a lot of people to call is that there's a lot of physicians in your area. There's a lot of nursing homes. And when I say you're calling 50 people in a day, I'm not saying you're calling different people. When we create a follow-up process, we expect you to call everyone every day. Every week. So you really are only targeting about 200 people at a time until you can convert them into your VIP list. So in a daily basis, you should be calling a minimum of 50 people a day. Out of those 50 people, you're looking at about half of those should be for potential referrals. The other one are new calls. The first, potential referrals, which those are your follow-ups, and the other half, the other 25, those are your cold calls where they haven't really or met you or know anything about you. You're just trying to get that appointment with them. Now that's always the minimum. That's a 50-50 split. Okay? If you increase your calls, you also increase your follow-ups. You need to be able to have a follow-up training, a follow-up technique. So imagine that if you're calling new calls, if you go by the minimum, that's 25 a day. Within 5 days, that's 125 days, 125 phone calls in a week. So you're looking at what? So you're looking at literally, if you do that within 4 weeks, okay? If you do that into 4 weeks, how many is that? That is close to what? 500 phone calls a month. That's 500 phone calls a month. That's amazing. You just spoke to 500 new people a month. And that's the bare minimum that I expect of you guys, that I expect of your marketing team, of your, liaisons and your marketers. So just imagine if you call 500 new people a month. And with the techniques that you're going to learn, you increase your potential appointments to about 20%. Okay? About 20%. That means you're meeting 100 people in a month. Now look at the conversion. Let's say, for example, you have a 7% conversion rate. Meaning after you meet 100 people, that you can convert just 7% of them. And that's bone stock minimum for people of average marketing capabilities. So now you're converting 7 new referral sources in a month. If you take great care of their patients, and each one of them, just let's say, for example, bare minimum refers to you 1 patient a month. If every month, within 10 months, you increase your referral census by 7 people referring patients to you, by the time that you hit the 10th month of your marketing strategies, you should have 70 new referral sources. And if they are giving you just 1 patient average a month, that means you should be able to have 70 patients coming in a monthly basis. That's creating a bone stock marketing strategy for you. So yes, you want to increase your calls, but you also want to increase the capabilities of your phone calls to be able to have a high conversion for appointments. And imagine if you learn some of the great, presentation techniques and adding products and services into your company to make yourself valuable to the patients. That's going to increase the conversion of those meetings towards potential referrals. So understand that the goal here is not the quick fix system, because if you don't have a follow-up process and system, you may get referrals, you may get a new referral source, but you may lose them immediately as well. So understand, cold calling is literally that important. So does it work for you? How many times you do it is so important to know. How does it work for you? Well, you need to be trained for it to work well. Now let me ask this: when people call you to cold call you to be able to have you, increase the rankings of your website in Google, or you get somebody who wants to change and convert your electricity away from ComEd or the other typical local companies, or somebody calls you to try to make you buy insurance, or somebody calls you to try to ask you to donate some money, did it actually work for those people to gain your business? What I want you to then look and understand and answer is, what did they do wrong that made them not valuable towards you as a person? So I want you to be able to start studying that. So I've literally studied people that are great and amazing in the phone, has great skills with the phones, yet I've also studied people who do not know a single thing on how to make a correct phone call. So when I ask the bare minimum of 50 calls a day, which is the bare minimum, some of the top marketers that I know will call a minimum of 150 people a day. And like I said, look, you're going to be able to get a hit or miss. Not everyone's going to be converted. How much time does it take to make a phone call? How much time does it take to be able to make that follow-up? You're talking about maybe 2 minutes. Okay? If the call goes pretty well, and you're going to be able to get 5 minutes to get that appointment. Your job is to get in and out. If you're making 100 phone calls a day, that's only 200 minutes. Okay? What's 200 minutes a day? That's only like about how many? About 3 hours. About 3.5 hours in a day. That's if you're making 100 phone calls. 100 phone calls. Okay? You need to be able to increase the amount of people you're meeting. So your calls needs to be between 50 to 100 a day. It's very important to be able to set time aside when you're making these phone calls. You need to be able to go ahead and structure your day to be able to make sure you fit this in, because this is part of your business. It's easier to make phone calls than spending time going door to door trying to get those people to meet with you. So let's talk about some of the cold calling rules that you need to abide by to be able to make your cold calls great, to be able to make your cold calls even better than the others out there. Number one is immediacy. Have you ever done this where you told yourself you're going to make a phone call, you're going to go visit someone, you're going to say something to someone, and then all of a sudden you don't do it, and then you'll say, I'll do it later on, I have time. So immediacy is the most important thing. So you need to be able to make sure the moment you decide that you're making cold calls, set aside time for that particular time of the day and make those cold calls right there and then. Don't start telling yourself, I will go ahead and do this later. So you should have a time. Let's say, for example, I'm going to make phone calls between the hours of 10 to the hours of 11:30 in the morning. Then I'm going to make phone calls between the hours of 3 to the hours of 4. Okay? Set aside the time, and when those times come up, set it in your alarm. When it alarms, start making phone calls. Within 15 seconds, if you don't do what you're thinking, most likely you will never do it, or you will postpone it. And that's how procrastination works. Rule number 2, be persistent. Okay, most marketers, most sales reps are making 1 or 2 calls per lead before giving up. Okay, so be persistent. Just because you don't get that appointment that first time you called, remember, it's not just a failure, it's gathering information. So when you get that person on the line, find out who they are, make a profile of every company that you call. You need to be able to have your CRM, put in your CRM so that you know when you called them last. You can make a follow-up, okay? You don't have to do things by writing things in pieces of paper no more. This is where we teach people to be able to make sure to take advantage of the different solutions out there, of the different apps out there. Be persistent, okay? Most people will not even try to call the second time if they failed the first time. So let them fail. Don't let yourself fail. Typically, it will take us between 3 or 4 calls before we even get an appointment for everyone. For most people that I know who are great at marketing, their conversion rates of phone calls to be able to get an appointment is somewhere around between 20 to about 25% for the first time. For the first time that they actually call someone. Okay? So now, what you want to do is you want to follow up the second time. Now you have a name. Alright? It makes it easier for you. But the thing is, if you don't get that, are you going to follow up the third time? Most of the time you'll say no. He already said no. He doesn't want to meet with me. He already made the excuse that he doesn't have time. No, that's just an excuse. Call again. Maybe the person you're speaking to just had a bad experience the call before you did. Are you going to follow up the 4th time? Are you going to follow up the 5th time? Are you going to follow up the 6th time? Okay? You need to be persistent. And if you're dealing with nursing homes and you're dealing with hospitals, it's going to take a lot of time and effort. So you're going to be making more phone calls. You're going to keep on making these phone calls on these companies. Okay? So be persistent at what you're doing to be able to get that. Next thing is time of day. Rule number 3. When to call doctors, discharge planners, and MSWs. Okay? When would be good times to call? When would be a great time for you to start calling? I have several rules that I kind of go under by. I don't like to call people during lunchtime because you don't want to bother them during lunch. I don't want to bother them during the first hour of the day that's open because they're trying to catch up. And I surely will not try to call them after 5 o'clock. The sweet spot is always between the hours of 10 to 11, 10 to 11:30 or so, or 9:30 to 11:30, and a sweet spot of about 1 o'clock to approximately about 3:30. Those are always great times to make the phone calls. So time of day does matter, and there's studies out there that proves this. Because remember, you don't want to try to speak to somebody when you're trying to disturb them from meetings. You don't want to disturb them when they're trying to eat, okay? And then you don't want to disturb them when they're trying to leave work and finish up the day. Rule number 4, know when to call for doctors, discharge planners, and MSWs. So the day of the week is also important, okay? So I say call 50 a day minimum, right? So Tuesdays and Thursdays are the best time to make any cold calls. That's the best time to make any cold calls. Well, this is the first contact that you're making. So Tuesdays and Thursdays is where I spend literally my cold calling days. Mondays and Fridays are my follow-up calls, where I'm following up people that I've actually met already, following up with people that I already had the initial introduction, following up people that I already sent a letter to, following up with people that I sent a fax to or an email to. Okay? So Tuesdays to Thursdays are great times to actually do what? Make your cold calls the first time that you're actually meeting people. Okay. Now, I teach you guys scripts. I give you scripts to be able to memorize, to be able to know. I do not suggest you to use scripts when you're making a phone call. And when I'm talking about not using scripts where you actually have to read it yourself right there. It's okay to have it in front of you as a guide, but you should already have the concept in your mind on how to be able to say the things. If you literally have to grab a call, and make a call and then grab the card and say, don't use scripts unless you have it memorized and can improvise. Okay, it sounds like you're reading. And you don't want to sound like you're reading because you don't want to sound crazy. Okay? You want to be able to deliver the information in the phone. You want to be able to deliver and show them that you already know it. When you're presenting, you don't want to be reading your presentation. You just want to have it there as a guideline for you. So when you're calling people, you want to be able to memorize the scripts, have it ready in your head, and have it flow out of your mouth really fast. Have it flow out of your mouth where you don't have to fully think. It should come naturally. It should come effectively. You should be able to talk to them correctly with the correct words, to be able to speak to the people fluently. I'm not saying you have to be grammatically correct. I'm not the best person to be able to teach you how to properly use your grammar. I don't even know that sentence made sense. It should make sense, right? But the thing though is, the most important thing is to be able to deliver information clearly. Talk about body language. If the person in the other line of the phone call is talking really fast, don't talk too slow because you're not in their level. Talk to match their level. Try to be able to mimic them to see how they're doing it and do it that way. If you have a person in the phone, okay, in the other side of the phone, and the way that they actually answer is they say something and then they take a quick pause where they say, "Hi, this is Janet with Dr. Patel's office. How can I help you?" And they take that deep breath. What you can do is you can answer the same exact way. "Janet, I appreciate the fact you're on the phone. I want to be able to share something with you." Now, I'm not saying make that sigh loud just like they did. What I'm just trying to say is you want to create the same pause that they have. This is one of the most hidden secrets by some of the best marketers and salespeople out there. The whole cold calling techniques is very important. And we spend close to about 4 hours of body language and nonverbal training because this is vital. And this is what makes you stand out and how it becomes different. When we're communicating with people, we want to understand that, are we having communication or are we having a conversation? Okay? Is it communication or is it conversation? Because if we're conversing, we're just talking. We're just talking, chit-chatting, so-and-so. But there is a big difference between that and communication. Communication is an exchanges of information, of valuable information that's going to be able to help each side be better. So you want to be able to communicate with them and not just have a typical nonsense of a conversation. Conversation are for the regular times of the days, to be able to have a chit chat, to be able to have meetings, to be able to have, a quick understanding of each other, to be able to say hi and bye. But for us to be able to get business, to be able to get referrals, we need to be able to literally easily communicate to people. So that's where cold calling is so important. We need to avoid conversations, okay? The back talk or the side talk stuff. Put that in the side, okay? You can use that as a nice cold opening, like, how's the weather out there? Or, tell me about how busy it is for you. Look, their time is valuable. Show them that you value their time. Take it easy. Avoid the little small chit-chats and go straight to the communication of what you're trying to get. You need to have purpose. When you make a phone call, your purpose is to get the appointment. Okay? So stick to that script. When you call, can you handle those objections? You will, and you can, because I'm giving you scripts. I'm giving you already the knowledge of what you're going to expect. You're going to get somebody telling you, "I don't have time." You're going to get somebody that's going to tell you, "We don't allow solicitation." You're going to get someone telling you that they're not here right now, "Leave your brochures." Do you know how to be able to respond to that? You have to understand, success is rewarded to you if you prepare. Success rewards preparation. You're not going to be successful unless you prepare yourself, unless you prepare your team. You have to understand, when was the last time that you practiced? When was the last time you actually was practicing how to make phone calls? I can guarantee you, when I ask this question, nobody can actually answer that. They will say, "Never. I never had, Michael. I thought about it. I kind of imagined how this phone call was going to go with this physician or with this administrator." But did you actually come up with scenarios? Did you come up with a mastermind group? Did you actually bring a friend over and say, hey, I want you to sit here. I want you to say this, give me an objection, and I'm going to answer to you right away. Can you answer really fast if I tell you I don't have any time? What's your answer? What are you going to tell the physician? You say, you introduce yourself to me right now, pretend we're in the phone right now, ring, ring. You say, hi, this is, Janet with ABC Home Health. I want to be able to speak to Dr. Patel, and I'm Dr. Patel, and I tell you, you know what? I'm busy right now. I don't have any time. Typically, people will answer, you know what, doctor, I apologize for taking your time. I'm really, really sorry. I'll call back later on. That's a typical answer of the average marketer, of the amateur marketers. I want you guys to become professionals at what you do, to become professional marketers instead. Have you ever hung up on yourself? Meaning that you were about to make that phone call, and the moment that the person answered, you just hung up on them? And, whether it's personal or whether it's business, because you didn't know what to say, you were lost for words, because you didn't prepare yourself. So it is important for preparation. Very important. Now, when you're cold calling, the first 15 seconds, your job is not to get them to hang up the phone. Because that first 15 seconds will determine is if you can go past that. If you can go past the first 15 seconds, then you did a great job. Okay? The second 15 seconds of it, so that's within 16 to 30 seconds of the call, is to get the intended target. You need to be able to qualify. Do you have the person in the phone right there and then? If that's not the person, stop presenting to them because they're not the important person. The most important person is to go past them to the right person. So first 15 seconds, your job is not to get hung up on. Okay? Second 15 seconds is to get the intended target. Now, between 30 seconds to 3 minutes, you have a window to make a pitch and create value to why it is worth the time for you to give a presentation and give a pitch. That's your job. You have to get them to stay long. The longer you get them in the call, the longer you have chances to be able to have a presentation. So one of my first techniques that I do to try to challenge people to see if they're willing to take advantage of this is literally I tell them to go ahead and call someone. Pick up the white pages if you have one. And what I would say is this. Go ahead and call someone that you never met. Go call a business. Go call somebody that you don't know. And what you're going to do is you're going to ask for a movie recommendation. You're going to ask them to go ahead and recommend a movie that you should be watching. And if you can have a full-blown conversation with the person who you decided to call that you never met, and you can make it last for 3 minutes, I challenge you to do that for 10 calls. 10 straight successful calls that you can get the person to stay in the phone with you for 2.5 minutes. Now, a lot of people say, well, Michael, this doesn't really apply to us because, this is home health. This is home care. This is hospice what we're trying to do. It's a challenge. If you can actually do this, then you can literally call anybody else. I've even used this techniques when I hire new marketers. I give them the phone and I say, all right, call. Or at times, the next level is, okay, here's the phone, go call this physician and set up an appointment. My goal is to literally see if they're willing to just grab the phone right there and then. Not worrying about the success or the failure. It's a matter of trying. If they hesitate, then I know that they're going to hesitate to do the real thing. If you can't even ask somebody for a phone number or for a recommendation for what type of movie to watch, do you think you're going to be able to actually call someone and ask them to start referring patients to you? If the main person you want to speak to is not in, make sure you always gather information for a later call or for your cold walk-in. Typically, when we actually make cold calls and after the third cold call and we still do not get a response or get that person to at least say yes or no for a meeting, that's when we will do and assign that particular contact as a cold walk-in. Because by then you should already have the information on who works in his office, who his assistants are, what type of patients he's working with. By the third call, you should have a lot of information and written a lot of stuff in your black book about this particular contact. So this is the person that's going to deserve a walk-in from you. This is what we call the cold walk-in, where you have to go in and meet with this person and try to corner them and get the information that you want, and try to get them to commit to actually start referring patients to you, or to get them to commit to allow you to present to them. So those are very important. So let me go ahead and share with you guys more information. So this is a sample script. Hey, Dr. Patel, it's Michael. My intention for this call, sir, is to introduce you to our services. This is once you get the person in front of you. Services that will absolutely benefit you now and your patients. Do I have your attention? Now, why did I put do I have your attention in it? Because you want to be able to make sure that you're not lost. Look, Dr. Patel, it's Michael. My intention for this call, sir, is to introduce you to our services that will absolutely benefit you now and benefit your patients. Do I have your attention? They say yes or no. They say no. Then you can say, well, what can I explain to you? Or, well, pay attention. I'm going to be able to I'll be able to gladly share with you amazing stuff. So let me ask you, when working with an agency, what is important for you? Okay, so let's repeat that. Hey, Dr. Patel, it's Michael. My intention for this call is to be able to introduce you to our amazing services. Now, these amazing services that will absolutely benefit you now. Do I have your attention, sir? If he says yes, great. Let me ask you this, sir. When working with an agency, because I absolutely know when I called you that you are already working with a home health agency. What is important for you with that agency? They're going to give you that first answer. And when they say the answer, you're going to say, excellent. Or you're going to say something like, I agree. That's a great choice. All right? Then you can say, well, what else, sir? They're going to give you the second answer. Great. Well, what else would be the third one, sir? And they're going to give you that answer. So then what you're going to do is you're going to repeat what they told you by literally saying, so you say that answer 1, answer 2, answer 3 is important for you. Tell me, what are your major concerns that you have faced with the agencies you're working with? Are there any other major concerns that you have? They're going to give you answer 4. Okay? So what you're doing is you're setting them up. So now that you and I will work together, what I'm doing here is I'm supposing a presupposition already of saying that I know I'm going to be working with you. So now that you and I will work together, when my team makes sure that answer 1, 2, and 3 are taken care of, and that we don't do number 4, okay, will that make you happy and be appreciative and making that commitment to start working with us? Great. I'm really looking forward to working with you. Also, let me tell you more about our services. So this is just one of the small scripts that you guys can actually use. Can you actually remember that? Without going back on the videos, do you remember the script? Okay, so let me repeat it again for you guys. Like, hey, Dr. Patel, it's Michael. Thank you for taking some time. I can only take a few minutes of your time, 2.5 to 3 minutes, because I know time is important for you. My intention for this call, sir, is to introduce to you our services. Amazing services that I absolutely benefit you now. Do I actually have your attention, sir? And by the way, it's also going to be able to do what? Take care of your patients as well. So it's beneficial for you and for your patients. Do I have your attention, sir? Well, yes, you do, Michael. Great. Let me ask you, when working with a home health agency, what is the most important thing for you? Because when I actually made this phone call, I know that you are working with a great home health agency because you are a doctor and you want great care for your patients. So what are important for you with an agency? They're going to give you answer 1. So you're going to answer, excellent, sir. What else? They're going to give you answer 2. That is great, sir. So what would be another third one possibly? They're going to give you number 3, right? So, sir, you say that answer 1, answer 2, answer 3 is important to you. Tell me, what are your major concerns that you have faced with the agencies you're working with? They're going to tell you number 4, there's always some concerns, or there's always something that they can improve upon. Great. So now that you and I will begin to work together now, if I can do blank, 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 and not blank, which is answer 4, would that make you happy, and would that interest you in start servicing and working with our company and getting that commitment to take care of your patients? Well, of course the doctor is going to say yes, that he wants to take care of his patients. But I snuck in the part of what? To start working and get the commitment to work with our agency. Great. I'm really looking forward to working with you. Also, let me tell you more about our services. I have some amazing information that you would take value on. So what I did there is I added some more custom words in that. I don't have to go by the script perfectly. So by me being able to add words to it but still use the backbone of things, I can customize it as it goes. I can add things that I see as important to him or her or them. Okay? So that's just a quick sample script that I truly suggest that you guys can work on and add and customize it for yourself to make it better. But you always want to make sure that those are within those realms. And that's a practice script. At least that is being given to you. If you have something like that in front of you, you can start practicing and using it. Okay? I want you to understand that phone calls is the most effective way of communication, right? It saves you money. 92% of companies miss out on business due to the phone because they don't even pick up that phone. 80% of all transactions and referrals takes place in the phone. So your phone call is so important that you have to be good at it. Making cold calls, but understand is, as a home health agency, when physicians are calling you, guess what? It's by phone, okay? If there's a transaction needed, if you need to be able to set up an appointment with a physical therapist, you need to be able to be using a phone. So phone skills are so important, and you should actually be a professional at it. 85% of referral sources are dissatisfied with phone interactions. How many times have you actually conversed with somebody on the phone and you were upset because that person wasn't making any sense? That person sounded impersonal. That person in the other line was rude. That person in the other line was monotone, right? Have you ever spoke to somebody and they sounded like that guy from Ferris Bueller, where they just were monotone? And I want you to be able to understand, and that's what we teach people when we do our phone skill techniques, is that when you're teaching people, when you're talking on the phone, you don't want to just sound monotone where it's just one tone going all the way throughout. Ferris Bueller, where it just sounds like that. It sounds like a little robot. You want to be able to speed up your voice. You want to be able to increase the tone, but at the same time lower it and slow it down. Have a pause, or just talk really fast. What you want to do is you want to take them in a journey when you're making these phone calls. And at the same time as when you're talking on the phone, smile. Smile all the time. In the beginning, I would literally put a mirror in front of my desk. So I will look at myself when I'm making phone calls. And the reason why I do that is because if I'm making a phone call and I'm smiling, then I'm projecting happiness, projecting positivity. And understand this, it takes 5 to 7 phone calls before you get a transaction, before you get them to start working with you, before you even get them to get that appointment. But I don't even wait for that. That's why I tell you guys, after the 3rd call, if I don't get an opportunity to have the meeting, we will do a cold walk-in. And did you know that 91% of marketers in the home health industry never meet their quotas? This is me surveying 700 home health agencies and home care companies. And this is why we have such a high turnaround of marketers in this industry. And the worst thing about it is these marketers, they can get a job that fast. All they have to do is go from one home health to the other and not worry about it. Your phone calls, okay? The most effective way of communication, but did you know it costs 1/8 less to get in touch with someone than driving around doing cold walk-ins? You can make 100 phone calls in a matter of 3 hours, but how many places can you visit and make a cold walk-in within those 3 hours. Even if you say you have an average of about 15 minutes between drive and walking in and talking to someone, that means you can only visit 4 people in an hour. In 3 hours, that's only going to be 12 people. But what if you can actually make the cold call, get the appointment, so that when you visit them and do a presentation, you don't have to go you have to go past all those mumbo jumbo stuff, and you go straight to the informational meeting to be able to share the details about your company, about your products, about your services. Do you know how much it will cost you if you pay someone to do a cold walk-in? Let's say, for example, you're paying yourself a marketer. You're paying that marketer if you do it correctly, but I've seen it where people pay marketers $25, $30, $40 an hour. Let's say just we stay on the middle of $20 an hour. In an 8-hour shift, if they visit, okay, I'll just take off an hour from that because 30 minutes for break, 30 minutes for transportation, go to work and after work, we'll say. So that's an hour. So now you have 7 hours worth of cold walk-ins, okay? So at 7 hours, if you visit 4 people, so that means you can only visit how many people? 4 times 7 is 28. You have a potential to only meet 28 people. That sucks. And that's a cold walk-in, okay? I want to spend my marketer's time in the field for meeting people who they already have appointments with. Not making a cold walk-in and hopefully getting an introduction. And then hopefully being able to schedule a meeting another day. So, one, making phone calls. You can increase it by doing what? 100 phone calls, 150 phone calls a day. Compared to 28 visits in a day. So it makes perfect sense. Okay? It makes perfect sense. So a cold walk-in, if you're paying somebody, okay? If you're literally paying someone $20 an hour, it's costing you about $5 per cold walk-in. But if you do the math and you made 100 phone calls in 3 hours, you divide that by 3 hours, that is more cost effective for you. So phone calls. When someone agrees to meet with me by phone, I can literally tell you that 1 out of 9, I will get a referral. So if someone agrees to meet with me by phone, so by phone they commit to me that they want to meet with me, if I do a presentation to them, 1 out of 9 will start referring to me. Now, they'll start referring to me. They'll have the agreement to start referring to me. They'll try me once, but that's where you have to then train your team and your staff to be able to take care of the patients correctly. If I do a cold walk-in, it's more like 1 out of 18 of me being able to get them to commit for a meeting. Okay? And the reason for that is because I'm literally taking their time. So I always tell people it's always good for cold calls to be able to make that first introduction and meeting. Let me ask you guys this. Do you have a copy of your ratios? What's your conversion ratios? Do you have one? Do you keep track of the conversion ratios of your marketers that you're working with right now? If you're just starting off your company, be able to make sure that you do have a conversion ratio of your current marketers. If you're the marketer for your company, you want to be able to create a report on a daily basis on what you've done and what your conversion ratios are to see how you're effective. When I speak to someone, when we create our black book that we call, but we actually use a CRM when we're making cold calls to people, we have a notes section where we're literally going to write down information of what happened in that conversation, what we talked about, what information did I gather that could be valuable, what are the things that I shared with that potential referral sources. Okay, I want to be able to take great notes and have great charting for that. And the reason for that is because it allows me, okay, it allows me the capability to be able to improve myself, to be able to see where I made a mistake, because I'm not perfect. I try to be perfect, but there's no such thing. And because I already have the belief that there's no such thing as a perfection, I will do my best to see on how I can always improve upon my mistakes. And let me tell you this, one of my best marketers out there was my receptionist. It was a receptionist that was working for me that wanted to try it. She had great personal skills. She already knew the home health industry. She already knew how to be great in calls. So when we changed her over to start cold calling, it was easy for her. And she loved it. Okay? So you have to understand, when we are hiring new marketers, sometimes look within. Look within your company. Because I will guarantee you that most of the time, those are great places to find your current person. Because they already know your business. They already know your company. They already know your workers. They already know the capabilities.